But I think we're ready for our next talk. And I want to briefly introduce, we've had Onyinye mentioned already in the lunch break talk, but no better person, I think, to speak about leadership. Onyinye, I came across probably around maybe 3 years ago. We were doing some work at an IMG conference, actually, for GP trainees. And we did some role playing doing Onyinye, which was good fun. And then we've bumped into each other a couple of times since then. It's been really, really great to come along and do this talk for us because our hands are very full, as you can see. Currently a GP in Birmingham, lots of passions with medical education. It's definitely one of them, both undergrad and postgrad level, teaching medical students right the way through to examining GP trainees for their exit exam, as it were, at the RCGP. And there's also clinical lead for the BME staff network for general practice in Birmingham Solihull CCG, the guys you just heard of just before the break, and also co-chair for BME West Midlands Network, plus many others that we couldn't fit onto this slide as well. But Onyinye, thank you so much. Welcome to the conference, and I'll hand over to you.
So last year, I'm going to start with telling you a story. So last year I was listening to something that Sky News, they had done this research and they were talking about leadership. And one of the things that they were looking at was they looked at about over 1,000 companies in the UK, and they were looking at who their leaders were and how many of them were from the diverse ethnic group. And honestly, I was so blown away when they found out that out of that 1,000, only 51 were from diverse ethnic group, and that actually broke my heart. And even amongst that, so just think about it, within the NHS we are like 20% BAME, but out of all of that, only 6% of the NHS trusts had one of us, somebody that looked like us, as their CEO. And even out of all of that, only one out of the whole 51 of them, they only found that just about 10 were women. And that tells you something. We're not at the places where we need to be. And why is that important? The problem with us not being at that top leadership level is that if we're not around the table, decisions will be made for us and not with us. And then those decisions that are made then bind us as individuals. And when you're an IMG, it's even worse. And that is the reason why we end up all the time being referred to places like the GMC. And we tend to have poorer outcomes at work because we're not at that leadership table where decisions are being made. And with all the best will in the world, if somebody wants to make a decision and they don't understand you and they don't have your lived experience, there is no way they can make any decision that would influence you, that will actually be, will I say, conducive for you, because they don't understand you. And that for me is the main reason why I went into leadership. So my name is Dr. Okonkwo, like we said, and he's told you quite a lot of things that I already do. I am an educator. That is my main thing. I love teaching and training. And I love to make sure that we have a community behind us who's able to take over when we decide to retire. So how did I get here? I was smiling when I heard the jollof rice and plantain thing, because that is a Nigerian thing. And I graduated from University of Nigeria. That was 1998. For those of you who are from Nigeria, you know we have a lot of strikes, quite a few of them. And most times when they happen, they tend to delay you and you have to spend extra time. So I ended up, rather than being class of 1998, we finished 1999. I did my pre-registration house officer, and that again, I was caught up in another strike and I ended up doing an extra 6 months in pediatrics. But honestly, I would say I came away all the better for it. I came to the UK in 2001. I am lucky in the sense that my husband was born in London. He was born in Islington, in London. So I didn't have any of the visa problems and all that. I was assured of my immigration status when I immigrated to England. I did PLAB 1 and PLAB 2. Of course, I did IELTS before that. And while I was doing PLAB, I worked as a phlebotomist at the University Hospital, Birmingham. And I have to say to you, that was the strangest experience I ever had, because when I was doing it, you're literally like a fly on the wall. Nobody notices that you're there, and you're the lowest of the lowest in the totem pole. So it was quite a very weird experience, coming from being the doctor in the team to being the absolute bottom of it. But that was really good for me. Then I went into training. I started off as an SHO in psychiatry. I did that for a year because during that period I had my son. And then I went into the GPVTS. I started off in the Black Country because when I got here, I was told, you don't apply to Birmingham, you will not get it. So don't even bother. So I didn't. I applied to the Black Country, and I was lucky enough to get in. But the only problem was, I mean, you're talking about my son was 4 months, and within a few weeks, I realized, my goodness, I just could not cope. So I had to come and speak to our TPD then, who was Martin Wilkinson at that time, very understanding. And he said, yes, I quite understand where you're coming from. And he helped me to transfer. And then I started off at East Birmingham and Solihull, which is where I finished. I finished my training in 2006, and then when we used to get distinctions, I had a distinction because I think then if you got 3 and above credits, I think they gave you a distinction. So I did that, and I came out all bushy-eyed, blurry-tailed, ready to, oh, with my distinction, I'm going to get a job straight away. I'll be snatched up straight away. But unfortunately, the reality was quite different. I had to do locums. I did a salary job for 3 months, and I quickly ran away because the ethos of the practice didn't actually fit with what I had been taught. So I had to leave. And it was a difficult 3 years doing things. But you know what? I'm quite grateful for that 3 years because it helped me to become the person I am and gave me that opportunity to go around and see different practices and different areas. I went as far as Leamington Spa from Birmingham, and it just helped to shape the person I am today. So I am grateful for that. But eventually in 2009, I became a partner at my practice, which is the One Medical Center in Highgate, and I'm still there up till today. So what roles do I hold? You've seen some of them. So currently, at the end of May, I became the senior partner for my practice, and we are like 3 partners now, 4 salaried. So we're quite a few. I'm a GP trainer. I'm year 1 and year 5 community-based medicine tutor for University of Birmingham, as well as the year 5 for ski examiner. I am an RCGP examiner, so I'm an RC examiner, and at the moment I'm one of the 3 elected examiner reps. So I get to represent the examiners in all the committees, so like training committees, exam committees, things like that. I'm an FSRH trainer. What that means is that if you wanted to, as a GP, get extra skills or extra qualifications to be able to do anything contraception, I'm able to train you to do that. And then as of December last year, I became the clinical lead for Birmingham and Solihull General Practice Staff and Allies. We now call ourselves, we used to be called the BIM Network, but we're now called the Equality and Diversity and Inclusion Network, which is a fantastic thing because honestly, that has really, really shone a light on the all that affects us as a community of diverse ethnic people. And then January this year, I became the co-chair for the BMA West Midlands BIM Forum. So within the BMA, thanks to Chan Nakpol, now we've now have a forum that is dedicated to us, because in the past, honestly, I have to say, before I got involved, I wasn't quite conversant with all the things around the BMA, but getting into this BIM forum has really opened my eyes to the fact that we tend to forget that the BMA is actually a trade union. And if we don't get involved, unfortunately, you don't have a voice at the table. It's just that simple. So going into this BIM forum has helped us to kind of come together and try and get the BMA to think about things that are not just for all the doctors, but for issues that are pertaining to us as a BME group. And on our RCGP faculty, I am one of the co-chairs for, or one of the EDI champions. There are 2 of us, and I'm also the Birmingham rep on our Midlands faculty. And now, by virtue of the fact that I represent all the general practice staff and allies, I am now one of the GP reps on our ICS board, because Birmingham and Solihull is coming together to form an integrated care system. So bringing together all of us from general practice, the hospital, social care, public health. So I have gone on as a GP representative on the on the inequalities board to make sure that our voices are heard. So these are the roles that I currently hold, and there are others I don't need to tell you about. But you can see, for me, it's all about how can we build a community? How can we make sure that our voices are heard where they're supposed to be heard? And why did I get involved in all this? I'll tell you. I did not set out to do this. I have to be honest with you. I set out because this was my guiding principle. I absolutely believe that you set out to make a difference. I'm somebody that I don't like to complain. If I have to complain about something, I will go in and see what I can do to make a difference. And that is the reason why I got involved in all these roles. Because we tend to, England, we like to complain. If we don't have anything else to talk about, you find us talk, oh, the weather is this, the weather is that. We are a community of people that just like to talk about things that are not going well. And that's not who I am. I prefer, if I am going to, if I find something is not right and I think it could be done differently, I go and try and get involved. So for me, it's never been about what the role is and what it is called. It's always been about what can we do together? How can we change things and how can we make things different? So, what were the challenges? Why did I start to do this? Because when I got here, I quickly realized I don't understand the system. And now I look and I see all the young people, like I have absolute great respect for Daya and Natasha because they've achieved so much in so little a time. But when we came, we did not have that. We didn't have things like that fellowship. We didn't have people that were there at the top sponsoring us. You need to meet our manager. If you remember the structure that they showed, at the top is a lady called Ravi. She is our manager and she manages all the other leadership teams. And she is what I would call a sponsor. We need people that then at the time when I qualified, we did not have sponsors. Yes, you had mentors. Mentors are people that will just tell you, okay, how you can do things or maybe do it like this and all that. But somebody to actually sponsor you, talk about you, do all the practical legwork wherever they are. They're talking about how fantastic you are, what a wonderful job you are, making sure that you're sitting around that table. We didn't have that. So it took those of us in during that period longer time to get to where we are now. So that was one of the things that we found. When I came here, the culture was completely different. I remember my first year of psychiatry. I couldn't, because where I in Nigeria, it's actually rude to maintain eye contact with your elders. And I remember sitting in an MDT meeting and I couldn't kind of look at everybody. I couldn't maintain eye contact. And luckily, I had a consultant who understood because he was Nigerian. And afterwards, he pulled me aside and he said, do you realize that if you don't maintain eye contact, they're going to think that you're schizophrenic? And I was so horrified. And after that, I had to practice in a mirror so many times to kind of learn how to do that. So you can imagine having to go in a meeting and you're not maintaining eye contact. Everybody would think, oh my goodness, she doesn't know what to say. She's not confident. So some of those little nuances actually were quite challenging for me when I first started. There is not a lot of us in leadership positions. Like I said to you, I was looking at the res data that Birmingham and Solihull published last year. I was so sad to see that even in our CCG, at the level of band 8D, which is among the top, so we are very well represented in all the lower levels. But when you get to 8D, which are some of the top levels, there was nobody. 0% of those roles were held by ethnic minority people like us. And that actually made me sad. So you can imagine being at that, let's say you were 8C or 8B and you went to a meeting hoping to have somebody that is in 8D to support you. There weren't, because there isn't anyone at that level. And even now, for me, sometimes you go to a meeting and you find that you are the only person that looks like you. So that lack of support actually was quite difficult, and it is still quite difficult for me up till now. You will find that we tend to work harder. I have to work sometimes 10 times as hard as the others. I found out recently there's a role I was doing with a few people. They had more sessions being paid than I was. And that is the simple, honest truth, that you will find that you will work harder and longer to be able to be recognized. And someone was telling me recently about her experience. She has so much she's doing and only just got recognized for it. And that breaks my heart. And it's just simply because we're not around the table where we're supposed to be. We are supposed to be. If I have a penny for every time people say to me, you have to be very careful. When you take stick up your neck above the parapet, you will get reported to the GMC. You will do this, you will do that. And that is what drives us on the ground. We finish training rather than develop, because I can promise you there are so many of you that are leaders within this place. But the thing that puts us down is the fact that we're told you'll be reported, you'll be sent to GMC. We all, because we are afraid of what will happen, we don't take up the roles. We don't develop our potential because we're petrified of what would happen to us. And of course, we have quite a lot of us are coming from cultures where we're told to accept that there is a power distance index between us and the leaders. We tend to accept that the inequality in the system is normal because that is what we've been told to do. I remember when I was doing my training, we had consultants that you literally had to bow to when you saw them. And that is where we're coming. And up till today, sometimes I have to remind myself, listen, you have just as much a voice as everybody around this table, and you should use that voice. So these are some of the things that I found that kept me down, and it's taken me such a long time to get to where I am. And at the same time, it still sometimes makes life a bit difficult for me when it comes to trying to achieve the potential that I think I can. And I'm sure that also might apply to some of you. So, who is a leader? If we talk about how can you become the leader that you want to be? Like I said, most of you are already leaders. If your actions inspire others to dream more, to learn more, to do more, and become more, you are automatically a leader. If we were looking at each other now, or if we could see pictures of each other, I would have said to you, look to your right, look to your left. Whoever you're looking at there, you are the leader because you are inspiring them by being here today, wanting to know more, wanting to do more, and going out and telling people, oh, this is what I learned, this is what I want to do with it. You are already a leader. So most of us can be leaders. It depends on, do you want to be one? So what do I think as a leader? What makes you a good leader? I think a good leader is someone that listens. It's not rocket science. I know every people that I remember, honestly, I am still sometimes suffering from what do you call imposter syndrome, because sometimes people say something like, no, 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 it's not me. I remember someone offered me a job and she said, oh, I want you to think about being chief executive or something. I'm like, whoa, no, 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 no. I don't want the title. I don't want to be chief executive. And she had a good laugh. And she said to me, this is like the chief executive of two trusts. And she said to me, look, what do you think being chief executive is all about? And I'm like, when I think about chief executive, it sounds like this person in an ivory tower. I don't even know how to approach. And she said, no, the most important thing you need to have is to learn to listen. Be somebody that, sometimes you say, I've heard what you've said, but I've listened to what you've said. There is a difference. You can hear it, but sometimes you might not internalize it. You might not use it to do what needs to be done. So, as a good leader, you need to listen. But for you to be able to hear what they are saying before you can even listen, you have to be approachable. You have to be somebody that people feel you have an open door. My staff, they know they can call me at any time. They can text me at any time because I do text them, WhatsApp them at any time. And they all keep saying, oh, Dr. O, you know you need to switch off. And I'm like, yeah, 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 I will once I finish this thing with you. But you have to be able to communicate. You have to be somebody that they is there. They know that you're always there and you're always approachable. You need to expect the best. We've all been through the pandemic. Everybody's feeling tired. Everybody's feeling worn out. But you have to be the leader that says to your team, come on, guys, we can do this. Bring that positive energy. Don't be one of the people that is constantly pulling people down. Oh, I'm tired. Oh, it's too much. The NHS is bursting. We can't do this. Be the positive disruptor. Be the person that pulls people up. You have to be ready to achieve. You need to hold yourself accountable and hold your team accountable. It's not when things go wrong, you turn around and say, oh, but it was that person or it wasn't. No, we have a saying in Nigeria that says, uneasy is the head that wears the heart. If you're going to wear the hat as the leader, you have to hold yourself accountable first, but also hold your team accountable. You have to be determined. And sometimes you have to be absolutely decisive. You don't have to have all the answers. I don't know it all. I am still on a journey as I'm talking to you now, because I know there are some places where I need to get to, and I haven't got there yet. So I am still on a journey. And there are some times I will make decisions, but I'm not quite sure how they will work, but I will make them with all the information I have, with the best will in the world, and hope that it works. But you can't, as a leader, be dilly-dally. Okay, let's think, because you'll find that you won't be able to achieve what you need to achieve. And will all the decisions you make be acceptable to everyone? No. There will be times you will have to make uncomfortable decisions, and you have to learn to stick by it. You need to encourage. I've told you about that. More than anything, as a leader now in the NHS, you need to encourage. You need to be that one person that is always saying, oh, things are better than what you're seeing. I said to one of my colleagues yesterday, I am banning moaning from our whole surgery. I don't want anyone to moan anymore, because we need to start looking at the glass half full rather than half empty. Because otherwise, what you're going to find is you drain the energy from your team, and that makes them not want to achieve, because everybody feels, oh, it's too much, I can't cope. You need to respect your team, because you being the leader, you need to be able to, yes, they will respect you, but if you want respect, you need to lead from the front. Respect them first. They have their own job, they have their skills. You need to acknowledge those skills. Honestly, I'm someone that I like to know everything, and I like to not micromanage, but I like to be in charge. And I've had to learn, if you're delegating, you have to delegate completely. You have to trust that you have a team that can deliver. Otherwise, you're going to burn yourself out as a leader. So, but the only way you can do that is if you actually trust that your team know what they do, and you trust in their skills. So what do we do about all this? I've told you how I've got here. I've told you what I'm doing at the moment. All we're saying is that we need more of us. Start from where you are. What would be your journey? What legacy do you want to leave? For me, like I said, it's not about the role, it's about making a difference. Start where you are. You don't have to wait until you're clinical lead of this or partner of, no. Where you are at the moment, even if you're a junior doctor, you have other junior doctors that you work with. Start there, lead them, encourage them. Be that person that is always there for them to come to and talk to. And before you know what's happening, you're already being looked at as their leader. But the most important thing is you cannot do it alone. That a lot of us have found that from the hard way, because you find that you might think, oh, I am so good and I can do this, I can do that, I can do that. But you are one person. When the chips are down, where is your community? I was talking to a young doctor recently. She's quite dynamic. She's achieved so much. And I was saying to her, look, the only thing I see is you need a community. Because sometimes if you need somebody else to bounce ideas off, you don't know everything. If there are more of us in different boardrooms, in different committees, in different places, we bring that a rich experience, we bring that a diverse experience, and we can start making the difference. But then you cannot do it by yourself. You need your community, you need your network. And the fantastic thing is that we already come from communities that work together. And then you need to ask yourself, what resources do you need? How can you get to where you are? Make a plan, make a long, what would it take? What do I need? And start putting those things in places. You're not going to become a leader when you wake up tomorrow. It is something you need to work out. But unfortunately, you have to decide first, make a plan, and then work with it. Thank you.
Wow, Anya, that was amazing. Absolutely amazing. Thank you so much. Leadership is one of those things that is talked about a lot, and actually it's sometimes made, as you said, a lot more complex than probably it needs to be. But actually some of those really simple, powerful things that you talked about are what people need to hear. So thank you so much.
You're welcome. And thank you for asking me. And I wish everybody well. And I hope there'll be more of us in areas where we need to be so that we can actually make a difference. Because for me, that is the only way we can make a difference.
Yeah, 100%. And are you good for a couple of questions on you? Because there's been a lot of
Absolutely. Yes.
interest generated, not least from the background and talking about Nigeria. I've had a few comments coming in about that as well, which has been great. But yeah, it sounds like you had some. I guess all the roles that you did, you probably learned little bits here and there, and what works and what doesn't work, and it all helps as you go from one role to another, right?
Yes, absolutely. And you make your mistakes, don't get me wrong. You say the wrong thing, you put your foot in your mouth. But then as you grow, you learn. And that is why, like I said, you need a community. Sometimes you might not know how to get from point A to point B, but somebody within your community knows. And you can go back to them and say, okay, what do I need to watch out for? What are the pitfalls? What can I do to achieve this? Who do I speak to? If you have those people behind you, you tend to get further. Whereas if you go in and think, oh, I know what I'm going to do, you're just going to keep falling flat.
Yeah, absolutely, 100%. Peter, you've been seeing there's some questions come through, right? Did you want to add anything first?
Well, you know, really inspiring. And I've heard Oni speak before, but you know, I'm never surprised by how inspired she leaves me. And this whole feeling of community positivity, I think that's what we need to be hearing. And especially in the IMG world where they will face lots of stresses, they will face lots of negative situations. And I think just reinforcing your journey and how you still maintain a positive outlook is amazing, really, and that's key. Short, simple, effective messages. And actually, I loved the little message when I did my practice session with. So one thing I wanted to clarify, actually, so we've been calling you Onyi all this time, but you introduced yourself as Oni. So what's the correct way of pronouncing your name?
Onyinye.
Onyinye, okay. So this goes back to what the board was saying, wasn't it, in the morning about names and getting and making sure people get them right and understand. And it's because I've always said Onyi, and obviously,
Oh,
apologies because I always
Oni
get it
is
wrong.
fine. No, that's the full thing, but I say Oni most of the times. The
Okay,
actual thing is Oni.
okay,
But most people can't say Oni, so they say Oni.
yeah, no,
Ah.
fantastic. But let's just
Well,
get to some questions because there's some strong questions that have come through.
yeah.
So the first one is, how can I show my leadership skills without coming across as bossy or insensitive?
Oh wow, yeah. Be prepared to be called bossy. Be prepared to be called how do I put it? What is the other one? There's quite a few that they band about when assertive. That's it.
Yeah,
Yes, but look, we have different styles of leadership, isn't it? There are some people that actually can talk the talk. There are some people that can do the actions. You have to decide what kind of leader you want to be. Some leaders are democratic, they pull everybody together. Some leaders are authoritative, they tell people what to do. You have to yourself decide what fits you and what fits the organization and the people you're leading. There are some times you would have to be, yes, be said to be authoritative because you have to be decisive and make the decision. But then there are sometimes you would have to be democratic and you'd be like, okay, everybody, what do you think? How do we do this? So it all depends on the situation. You have to start understanding who you are as a person, what kind of leader you want to be as a person, and also tailor that to the organization and the people that you're thinking of leading.
yeah, exactly that.
Brilliant.
Know yourself and know your audience, essentially, isn't it? Yeah.
So another question that's come through, are there courses needed for these leadership roles?
To be honest, sometimes yes, there are. I haven't had to go on any course for my leadership roles, you can see, but I know that when we first started with the CCG, they had, if you wanted to be a CEO, you had to go on certain courses. So in some instances, yes, there are. But in some instances, it's about your lived experience as well. So it's not necessarily that you have to go to this. But the other thing I found is that the newer generation, when we first started, there wasn't a lot of medical leadership. But now there is a lot of medical leadership. It's actually being promoted all around. So you will find that the younger ones, you're in a position now to kind of have the skills taught to you. You have the NHS leadership academy and all that. So you have these skills taught to you. But for me personally, I have to say, I wasn't given that opportunity when I first started. And I guess that is why it's taken me almost 20 years to get to where I am. And I'm hoping that most of you will be like people like Pooja, who started doing this younger and they were able to achieve quite a lot. Because when I looked at her fellowship thing, I was like, oh my goodness, she's achieved so much in such a short time. So hopefully you can avail yourself now of all those opportunities to actually train yourself up, and hopefully that would help.
And that really comes back to community. So she really does practice what she preaches. You know, she's really made a huge impact in the faculty itself. And she was just telling me about how my fellowship application came about and things. So, you know, it really is about a community. So make sure when you are getting into these roles, you're pulling up people behind you, because as we've just heard, you can't do it by yourself, and there's no point trying to do it by yourself. So just a few comments. I thought it'd be nice to share them with you, and then one final question, if that's okay. Her aura is incredible. Thank you so much. I feel so inspired. Amazing indeed. Very inspirational. So lots and lots of positive comments. It just shows what an impact it does make. Aman, do you want to ask the last question?
Yeah. So do you have regrets or bitterness that it took you longer to get to where you are than others might have when they started after you?
No, absolutely. Like I said, you know, sometimes you're going on a journey. You want to get there quickly and you want to do everything, but it's fine. It's okay. But sometimes you want to take the scenic route, because as you're going, and that's why I put on Twitter today, I am so grateful for my community. I have the young ones that teach me all about Twitter. I have the older ones I can go to and say, oh, please look at my presentation, make sure it's okay. So I have all that, and I've accumulated that because it's taking me through the scenic route to get to where I am. So I have no regrets whatsoever. But do remember, we are all different. We're all on a different journey. So whereas Pooja might have got to where she is because she's my new inspiration now in such a short time, some of us have taken longer, but that's our life journey and it's fine. So don't look at somebody and think, oh yes, that person is on this journey, I have to be on that journey. You go on your own journey. And for me, I am always thankful for my journey, and I'm thankful for how I got there.
Yeah, amazing. Absolutely amazing.
Yeah, it is great. And just one final thing that I do want to highlight in this leadership thing, I think often people aren't made aware of opportunities. So where would you signpost people to find out about these various opportunities that may pop up?
Okay, so first of all, I think one thing I think would have helped me if I had known about was, you know, careers fair, when they put up all these BMA, BMJ, GMC careers. I've never gone to one. There is a lot more to life than being a surgeon, a medic, a gynecologist. There's so many branches of medicine we don't even know about. Attend one, see what is out there and how you can get to where you want to get to. That is number one. Number two, NHS jobs tend to have a lot of all these things, and we have a WhatsApp group now of primary care leaders where we tend to put jobs in, because we're all so busy. We don't go to all these websites and all these seminars and places where you hear about these jobs. But if you belong to a community of people that are like-minded, they will bring it in. And that's the other thing. In our CCG, we found out they weren't doing that. So we've just had a conversation with our ICS chair to say, we need people like us to know about the jobs when they are coming out. So they've promised they will take it back, and that is because we're at the table. We've been able to say our people don't get to see this. Please, can you make it known to us? But for me, I would say BMJ jobs, what do you call it? The CCG, if you're in Birmingham and Solihull, they'll publish it. Look at NHS jobs as well. There are so many places that you can start looking. But the main thing is be curious. Do you want to know? If you want to know, I promise you, if you go out there, you will find out about the jobs.
Brilliant.
Thank you.
A
Thank
really
you.
good way to end. And Oni, thank you so much for your time on a Saturday. And I know you're watching some of the other ones as well. So thank you for spending the half day with us. And we really appreciate it. And so do everybody else listening, you can tell.
Thank you so much for having me. It's been fun.
Good, excellent. Brilliant. So Pooja, are you gonna introduce the next speakers?